After years of drinking, Martin has now been sober for almost 11 years. But despite his return to a healthier lifestyle, the damage has already been done. His alcoholism led to a liver transplant, insulin-dependent diabetes, heart trouble and chronic kidney disease. As someone who almost died because of his substance dependency, he's not surprised that the pandemic has led to an increase in the number of deaths from alcohol-related conditions.
Everyone's doing their best to keep their head above water and look as if they're functioning to the best of their ability. COVID has come along and it's been the straw that's broken the camel's back, I feel, and it's just been that thing that's been completely uncontrollable for individuals, so they've just had to take the escape route, and that escape route is substance misuse.
Sally lost her younger sister, a highly qualified engineer who had become dependent on alcohol just days before lockdown began last year. It meant only a handful of people could attend her funeral, and her friends and family were left to grieve alone during one of the most stressful times of their lives.
Watching your little sister on life support for 6 days after being told she would survive 5 minutes, you know, just waiting for her to die, it's awful, it's torture. But also the years before is a living grief. You know, she was dying in front of us.
According to Public Health England, between 2019 and 2020, the number of deaths from alcoholic liver disease rose by over 20%. Pre-COVID, between 2018 and 19, the increase was less than 3%. The number of all alcohol-related deaths also increased by 20% in 2020. And despite the pubs and restaurants being closed for over half the year, the amount of alcohol bought in England remained the same, thanks to supermarket sales going up by almost a quarter. Health campaigners say that deaths from liver disease have been increasing for years and could overtake heart disease as the main cause of premature death. A situation caused in part by alcohol becoming more affordable and accessible. And they warn that it's not only alcoholics who are at risk.
It's a really common myth that you have to be an alcoholic to get alcohol-related liver disease. But actually, 1 in 5 of us may be drinking at levels that are putting our livers in risk. Liver disease usually has got no symptoms in the early stages, so it's really important that people try to stick to the government guidelines of drinking no more than 14 units a week and having 2 to 3 days off alcohol every single week.
Public Health England's report concludes that nationwide it would help if alcohol was less available and less affordable. And for individuals like Martin, support and education should be available so that they too can change their drinking behaviour and live a longer life. Frazer Maude, Sky News.